Another question we have here is, my child has ADHD. Do these strategies work with children with special needs? Connie?
Yes, they work. It's more common now for our parents to ask us this type of question, be it their children have the diagnosis of ADHD or ODD, oppositional defiant disorder. And they come to us and they say, well, we've tried everything, nothing works. And so we get them engaged with Triple P in the group programs. And our parents end up leaving the program, and when we do follow-ups later on, they say to us, yes, it works. And they're amazed that it actually works. And with the philosophy of Triple P, going back to some of what Kathy was saying previously, it's about consistency. So when you're trying to parent a child with ADHD or ODD, it's always remember consistency, consistency, consistency. And oh. She has a need.
Poor little one.
Oh.
There we go.
I think just to add to what Connie was saying as well, is that parents that have children with ADHD or ODD, a lot of times one of our things we always ask is, why did you do that? But we have to change our expectations a little bit when we have a child with ADHD or ODD, because a lot of times these children work on impulse. They're very impulsive children. They don't think before they act. The thought comes afterwards. So when you're talking about ADHD or ODD, it takes a little bit more time to make this process consistent and ingrained for them. So parents with group do very well because they have 8 weeks to put this process into place. Mm-hmm. And we get to work on, maybe this won't work the first, the second, the third time because your child's still working on what comes naturally, so the impulse, but with time, the success will come. Again, going back to consistency and follow through.
Thank you. We have a question. I'm expecting, not myself.
Thanks for
Someone out there is
clarifying
expecting, and I am trying to get my 3-year-old out of my bed. Is it okay to let her cry herself to sleep? Trish.
I've been that mom. Is it okay to let her cry herself to sleep? Well, let's start with her being in her bed, and so she's 3 years old, and so developmentally you can have a conversation with her about that, and perhaps what I love about Triple P is there's lots of things for parents, like charts and different things, behavior charts and reward charts that we can work together on, and so kids love being rewarded. They love that positive reinforcement. And so at 3, what I would suggest is, making a really nice reward chart. I've done it. Kids, especially little girls, let's say, love stickers. And so, you could have that conversation about sleeping in her bed, and there's going to be that transition, and it's almost like time out, and there's going to be a difficult period where you're putting her back to bed over and over and over again, and you might start with if you're there for 20 minutes or if you're there for an hour, and gradually it will get better, and she will be staying in her bed longer, and she can be rewarded for that. Now, when we talk about rewards for good behavior, I do want to emphasize that children love, spending time with you. And so reward your children with maybe an afternoon at the park, an extra bedtime story at bedtime, something you're doing together. So, you're spending that time together and getting that quality time. So.
And if I could just add to that too, so going back to the question being, is it okay to let them cry it out? I think that's based on, is it okay for you as a parent? How do you feel when you let that child cry it out? So if you feel that, you can deal with that and you can do the follow through and let your child cry it out, then yes, it is okay. That is an effective strategy that you can use. It is a very direct approach. If every time you do that to your child, you're sitting by the door and you're like, oh my, I'm going to go in, no, I can't do with this anymore, then no, it's not an okay strategy for you to use, because the follow through and the way it makes you feel is maybe not the best. So in that case, you can use a gentle approach. And a gentle approach is going in the room with that child, but not giving them eye contact. So they have that comforting sense that you're there. So maybe the first week or the first couple nights, you'll have a chair right beside the bed. And you'll be facing the other wall. And you'll stay until the child falls asleep. And then maybe the second or fourth, fifth night, maybe, you're getting closer and closer to the door until eventually you're not in the room at all. That takes a lot more dedication, and maybe that's the approach you want to take, and maybe that makes you feel better as a parent, that you're there and you're supporting your child through every step of the way. And if that's the approach you want to take, that's an option. And if you want to do the crying it out, then that's another option. And it's really based on what can I live with and what am I happy with as a parent.
Wonderful, thank you. Can you tell us the difference between a group and a one-on-one? So the parents know what to expect.
I can do the comparison between the two if you'd like.
Yep.
So when you're
Go ahead.
doing one-on-one, you're identifying a specific behavior. So for example, if a parent would come up to me and say, I'm having a lot of issues with potty training. If a parent can identify a specific behavior, then one-on-one is probably the best option, because you're working through that issue. If on the other hand, a parent would tell me, I don't know where to start, my child's just not listening, my child is misbehaving, then at that point I would say group is the most appropriate, because what group does is, rather than dealing with a behavior, you're learning how to deal with situations and how to plan ahead for high-risk situations.
Sorry?
How long is the session?
How long is the session for a,
Session, one-on-one, or is it just one, or how long is it?
So this can look different from parent to parent, but the ideal way the program was designed was actually to be 4 sessions long. So your first session is a information sharing session, where your second session is kind of like the meat and potatoes, where after you've gathered some information, you have a clear picture of what the issue is. After that, then you put your parenting plan in place. So what you have a practitioner that would guide you through the strategies and through the process, and you as a parent take control of what would work in my home and what would work with my child. And then the third and fourth session is really supporting you through your strategies and how can you make that work in your home. Yes?
Do you know how long the wait time is for that program? Like, for example, I've got my meeting was for the Stepping Stones program, and I had to wait about a year to get to that program. Do you have any idea what the one-on-one, is that an immediate thing, or is that something?
The one-on-one is fairly quick. So depending what agency, depending where your request goes, the timelines are a little bit different. Overall, they're very short. You should get a call in a very short period of time to at least try to book that initial session. So the initial session is based on your availability as well as the practitioner's availability. So if you have a lot of restrictions, then the program does take a little bit longer to get through, such as stepping stones, because the more difficulties that are surrounding your situation, the less of practitioners there is in the community. So if we're looking at stepping stones, we have very few practitioners in our community, so the wait lists do get quite long.